Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Parkinson's disease, also called paralysis agitans. What is Parkinson's disease? This is a progressive neurodegenerative disorder characterized by tremor, rigidity, akinesia or bradykinesia, postural instability. The mnemonic for Parkinson's disease clinical feature is TREP, that is tremor, rigidity, akinesia or bradykinesia, and postural instability. There will be tremor, that is the resting tremor, peel rolling movement like that. Increased muscle tone, characteristic of cogwheel rigidity or lead pipe rigidity. Slowness in initiating movement, masked faces, gait disturbance and fascinating gait, stooped posture and decreased arm swing, micrographia, and groover voice. There is soft voice and seems to be agitating soft voice. So these are the features of Parkinson's disease. Okay. If you go to the epidemiology and demographic, this is a disease of onset should be around 40 to 70 years. And as the age advances, Parkinson's disease incidence increases. Parkinson's disease is the second most common neurodegenerative disease after Alzheimer's disease. About 1 million people in the United States of America are living with Parkinson's disease. About 60,000 Americans are diagnosed with this disease each year. It is a disease of old age, so it is unlikely to get Parkinson's disease before the age of 40. Incidence increases with age. About 4% of diagnosed Parkinson's disease patients are under the age of 45. Okay, if you look at the image, these are I've taken from the online images from PowerPoint Creative Commons. So if I have a section at this level, we'll have section of the brain. This is the midbrain area, and in a normal person we have the substantia nigra. This is pigmented. This neuron produces the dopamine that is important for normal motor function. In a patient with Parkinson's disease, diminished substantia nigra, the neuron will degenerate. So this will be pale color. So it will not be dark color. Okay, and as because these neurons are essential for the production of dopamine, so there will be lack of dopamine that will lead to Parkinson's disease. So this is normal brain. This is the cerebral aqueduct here, and this is the substantia nigra. We have the crus cerebri here, tectum. Okay, so this is the midbrain. This is from here. And when this neuron will degenerate, we'll get this is pale color, and that is the cause of decreased dopamine because neuron has been degenerated. So there will be Parkinsonism. So if you look at the features of Parkinsonism, again TREP is our mnemonic. There will be tremor, peel rolling tremor, worst at rest, rigidity led pipe rigidity. Person cannot flex and extend the elbow joint smoothly. Okay, so cogwheeling, like cogwheeling lead pipe rigidity here. Okay, akinesia, bradykinesia, serpentine stare, hypomimia, reduced arm swing, arm will not move when person walk, reduced frequency and amplitude of repetitive movement. If you tell the patient to move, patient may not move as fast as you like, as you command to that patient. works with co-stimulation, loss of postural reflexes, pull test. Doctor should pull the shoulder area from behind. Difficulty turning around, early fall. So it's because there is postural instability, person may fall. So forward tilt of trunk, it may be more kyphotic looking, reduced arm swing, shuffling gait. The strides are short stride and they will hesitate to start the walking. Rigidity and trembling of extremities, rigidity and trembling of head. Okay, so if we go to the histopathology, the neuron here, this is the neuron, this is the Lewy body. Lewy body is characteristic of Parkinson disease. This is present in intracytoplasmic inclusion body, that is called Lewy body. Intranuclear, intracytoplasmic inclusion body. This is not organelle, this is inclusion body. There is a part of degenerative process, like this are the Lewy bodies. This is Lewy body. Okay, so we got the Lewy body, the characteristic feature of the Parkinson disease. Again, typical appearance of Parkinson disease: stooped posture, rigidity, flexed elbow and wrist, so the arm does not swing normal like a normal person, trembling of extremities, shuffling short stepped gait, slightly flexed hip and knees, reduced arm swing, forward tilt of trunk, and masked faces, masked facial expression. Okay, so these are the features of Parkinson's disease, and this is the histopathology. So exact cause is not known. We don't know the exact cause, but genetics has some role, and it is found that it is little more common in male than that of the female, 1.5:1. Also, it is found that it may be more common in certain countries like Ireland, South Korea area. Environment may have some important role, and age. Onset should be 40 and above. As the age advances, disease becomes worse. Okay, so this all interplay. Exposure to insecticide, fertilizer, cleaning substance, heavy metal exposure like mercury or lead. Okay, and head injury like cerebral concussion in the boxer. We have a great boxer, Muhammad Ali. He had also Parkinson disease. Maybe due to concussion. Okay, are the possible predisposing factors: grossly pallor substantia nigra from loss of pigment cell, degenerative disorder of CNS with Lewy bodies, intraneuronal, cytoplasmic inclusion, and loss of dopaminergic neuron. There is depigmentation of the substantia nigra of the midbrain. We have seen that the pigmentation will be lost. Because of loss of the dopamine secreting neuron, loss of dopamine in the caudate nucleus and putamen. From substantia nigra, dopamine should go to the other part of basal ganglia. I mean, it will go to the basal ganglia like caudate nucleus, putamen. Okay, so you'll get less dopamine in the caudate nucleus and putamen. Source is substantia nigra, but they are connected to the basal ganglia like caudate nucleus and putamen. So what is the treatment for Parkinson's disease or the paralysis agitans? Treatment of choice is the levodopa or L-dopa. It is administered with that of carbidopa. It will be in the central nervous system. It will be the dopamine eventually. And carbidopa protect the levodopa in the circulation, and it help to get the levodopa into the central nervous system and to become so that it will be the dopamine which is deficient in a patient of Parkinson disease. We have dopamine agonists like ropinirole and pramipexole. We have monoamine oxidase MAO-B inhibitor Resagilin, seligilin, amantadine, COMT, 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 it work like that of dopamine agonist. Anticholinergic drug is essential because there may be dribbling of saliva, drooling may be possible in a patient of Parkinson's disease. So anticholinergic drug may work there. Physical therapy is very important, otherwise person muscle tone is been changed, line of gravity has been changed, so this person need physical therapy and care by other people so that he or she should not fall and should not have fracture of the body like that of the hip fracture. Hip fracture you can prevent by giving physical therapy that will help the person to be muscle should be more stronger and he may not fall, but no medication can cure the Parkinson disease. This will continue. Okay, so this should be treated by, this prescription should be given from a licensed neurologist or or assisted by the psychiatrist. Usually it is a neurological case. Okay, so we got that. And this person may have depression, that is a possibility also. And Parkinson disease, people have tendency to fall, so his environment should be okay. He should not fall, so properly some support systems for walking is essential at one time. And surgery may be required by the neurosurgeons to do on Parkinson disease, or they will put one deep brain stimulator so that will pass the impulse frequently, that will prevent the Parkinson disease further deterioration. But anyway, progression cannot be prevented, but symptom may be within control. So let's go to the highlight. It is a neurodegenerative disease, second after the Alzheimer's disease. Clinical feature, we have TRAP as the formula. Okay, TRAP, tremor, rigidity, akinesia, and postural instability. Okay, cause and predisposing factor. Predisposing factor like that of the exposure to heavy metal, head trauma, cerebral concussion. Okay, and genetic may be have a role, and female has less chance to get Parkinson than that of the male, and in some statistics it shows that it is more common in certain part of the world like that of Ireland and South Korea. Okay, we got the pathology. Our substantia nigra in the midbrain will be depigmented because the neuron will die out. Lewy body are intranuclear, intracytoplasmic inclusion bodies that are a typical finding in a patient of Parkinson's disease. Okay, so these are the highlight treatment. Yes, we have the levodopa carbidopa combination Cinmet. We have also MAO-B inhibitor. We have COMTs, catecholaminé O-methyl transferase. Okay, that may be also useful, and we may use the anticholinergic drug. Idea is that to decrease drooling from the mouth. Okay, and that's all about the Parkinson disease. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me. Have a nice day. Bye now.